My name is Dr. John Haas. I did my undergraduate training in medical school at Loyola University in Chicago and graduated there in about 1980 and was fortunate to go on to do my postgraduate work up at Mayo Clinic, Mayo Foundation, both in internal medicine and cardiology, finishing there in about 1986. Cardiology is a fascinating profession because it's involved primarily in the care of patients in clinical care, where you get to meet a wide variety of patients of all ages and all stripes and all situations. It's also involves a lot of interesting tools and technologies that we avail ourselves of in imaging technologies and procedural work. So it's something where your interest can be piqued every day as to what's new, what can be helpful, and hoping that we can undertake the enterprise to help people feel better over time. I see individuals with all kinds of common cardiac conditions. It could be as simple as hypertension, or it could be as complex as near end stage heart failure, both in cardiac vascular disease, heart rhythm problems. By virtue of the fact that I've been around in the system and practiced in town for well over 20 years, I have been exposed to, in aggregate, a lot of individuals with complex problems. I hope when a patient sits down that I am able to look at them and mostly listen to what their story and their concerns are. I think a lot of what needs to have happen is to primarily listen to people, try to understand them very quickly and efficiently as best we can in a way that helps them with what it is with the problems at hand. Medicine was something that kind of grew on me, and thinking as I went through college, and I was exposed to it in my childhood. Certainly, my father was a physician. He was a physician in the Navy. After the Navy, he took up and worked for practice in the kind of near the inner city of Chicago. Worked there his entire career, right underneath the L. It's something that he enjoyed to do, and I had some exposure over the course of years, and I suppose that certainly made an impression upon me, though he never directly lobbied me to have to do what I eventually did. One of the benefits of working in an institution like the Nebraska Medical Center is to have a cadre of individuals and partners that work around and about you, and with exchange of each other, both of ideas and in the care of patients, that supports our efforts on a mutual basis in what we hope to provide, good quality team care that is cutting edge.